primary care physician, it's an average of well over 2,000 people to one individual doctor. You have well over 2,000 patients to one primary care physician in a district. There are so many programs out there to give an incentive to doctors to practice, to open clinics in this district, but still the disconnect is still with us. When you talk about preventable hospital stay, we top the chart. Because things that can be prevented, we are not doing it, we are not proactive. The education, the information is lacking, even though we have it in various languages. Health and Hospital Corporation are doing their best to have it in so many languages and interpreters and on. But the district, there's still a disconnect within the individuals, within the citizens of this district, and the healthcare providers. Mammography screening, we are not doing good at all. Yes, we have the mammogram vans going around, but 61% not good. In fact, diabetes screening, we should be at 100% with all that we know about diabetes now, but we are just about 78%. Not everybody is being screened. So every day we still have new diagnoses on diabetes screening. Other factors which affect our health, socioeconomic factors. Very important. These same district, you have high school graduation, which is pegged at an average kid in a district will probably about 58% of them, maybe an average of 1 and 2, graduate in high school. When you talk about college, I'm not talking about graduating from college now. That is, some kids have some college experience or some college credits. You're talking about 48% of those who made it to college. But actually, less than 10%, about 10% graduates from college in our district. Child with poverty. I came from a system whereby I can see from outside in, looking with a wide lens stethoscope, seeing what it is. With child poverty in our district, it's very high, 41%, and 16 district is the seat of our government in the Bronx. And when you talk about unemployment, we're talking about well over 17%. But even if you divide it into minorities in our district, for men, it's over 25%. All the other social factors, providers, we are not doing well at all. In fact, the latest statistics about a single parenthood, which means that an average more than 64% of families are aided by single parenthood in our district, which put a lot of strain on the various households, head of households. I can go on and on. Our environmental factors. Our district used to be an industrial district. So many environmental factors affect us. When you talk about the fine particles, there was a study done recently to find out how polluted our air is, the various trucks that move in our district. There are various access to care, access to food distribution. In fact, fast food in our district is well over 65%, which of course accounts for when we talk about obesity. Now that takes me to the next topic. Obesity in our district. There have been several initiatives, which includes for various elected officials in our district that have tried to bring out several initiatives, but there is still a disconnect. The current administration have tried to ban soda in schools. There's still that disconnect. Obesity within our district is so high. And the cause of death in our district as a result of obesity and the complications, it's unimaginable. Diabetes. In 2013, 21st century, when we know everything, supposedly know everything about diabetes, we still have people dying from complications of diabetes. Hypertension, very high in our district. Men and women alike, not just gestational hypertension alone. People have to make ends meet. These are things that can be avoided, that can also lead to several other complications, blindness and on and on. Asthma. So many programs are trying to help to solve the problem of asthma in our district, but we know this is still there. When you talk about cancer, that is even worse, because where you get your first care makes a lot of difference whether you go into remission or not. Now, having said all this, what do I plan to do? When elected, it's not just if elected. The Bronx as a whole needs a doctor in City Hall. We cannot, at this time and age, 21st century, having the diversity that we have in the Bronx, having an opportunity to produce a medical doctor to represent one of the districts from the Bronx in the city council, we should jump at that opportunity. Let all elected officials, let all elected officials, let everybody come together and say, this is the time we cannot afford to miss this opportunity. What are the things that I intend to do? One, to bring a connection between the existing disparity within our health system and the realization on the ground, which is the community as a whole, integrating both parties. Two, the integration will start with my office, creating an advisory council, bringing providers together that will help the community directly understanding how to navigate the system of this new healthcare of affordable care health, which is Obamacare, which is coming to play starting January 2014. In fact, the changes in the healthcare will make insurance more affordable to more businesses. And of course, the price will go down by 50%, starting in the next couple of months, meaning that you can shop for your insurance. And this is great for private businesses, or especially for small businesses, even though this will not impact those of you that are that have health insurance being provided to you by your employers. But for the businesses in our district, which is the mom and pop stores, they are struggling. This will afford them the opportunity to buy insurance. And this will limit the visit to various emergency rooms. And this will limit the constituents using the emergency room as a revolving door. And this is what I stand for. I encourage each and every one of you. You know someone in District 16, you have a family in the Bronx, these great boroughs should come together to provide and produce, to give the support. September 10, come out and vote for Dr. Bola to be in City Council to represent the entire district and produce a second medical doctor to represent the community, meaning in City Council. Out of 51, if you have two, only doctors can fix the issues. In my daily practice, what I do daily, privately, I am able to help one person at a time. But collectively, sending me to City Council, I will be able to help thousands at a time. My office will be able to help each and every one of you. On various instances, individually, you know your commitment to your relatives, you know your commitment to yourself, When privately you've asked me, you've talked to me privately about your health issues, and I've given you wonderful and meaningful advice to the best of my knowledge, or giving you the direction of how to approach it. It's entirely up to you. But now, you to utilize that information and turn it into a vote on September 10th to come out and vote for Dr. Bola Omotosho, 16th District, and make him your next City Council member. And these, you will not be disappointed. We're talking about longevity. This is one place we've called home. Let's make it a reality. Let's make it a reality, affordable. There are several other issues which we face in the Bronx, but once we are healthy, the sky is the limit. Then we can address other issues. Thank you so much for listening, and I'm looking forward to your vote. And by 9:30 p.m. on September 10, we shall be celebrating together at the headquarters. In the interim, I ask you to volunteer to come out on that day. You can call the office at 718-644-0115. 718-644-0115. Also, you can go to our website, votebolaomotosho.com. This is not the time for legislations. This is not the time for additional programs, but this is the time for reality to do a health check, to really check what is the status of our health. Our community health check is not good. You need to visit your doctor. And this is him, he's here. Give him the chance. And thank you all.
Thank you, Dr. Bola. Well, there you have it. And if any candidate wants your vote, ask them for their resume. And I promise you, none will come close to Dr. Bola Omotosho. And if we have myriads of problems in this district, we do not need pretenders. We need actual individuals who can solve the problem of this district. And Dr. Bola just unveiled his health and wellness plan. Some we can do, others he can help us with. And with him at the helm, I can assure you, we will be in a better situation health-wise as well as economic-wise. So with that, I thank you very, very much from the bottom of our hearts for joining us, for listening, and for also following up with the status of the campaign with Dr. Bola Omotosho. Again, you can go to votebolaomotosho.com for more information about his candidacy. Or you can check our website, unitedafricancoalition.org. With that, I will see you on September 10 after we elect Dr. Bola Omotosho. God bless and have a great, great year. Thank you.